expertise that we have before us to come and do this topic the justice. So quickly, we're here to talk about mental health. But not just mental health, we're talking about mental health and the situation in northern Nigeria. But we know that when we talk about mental health, we always shy away from that because we're always scared of the topic. So before we talk about the situation in northern Nigeria, I would like Dr. Armiyau to just quickly do justice to mental health. Can you just tell us what really mental health is? Before we talk about the situation, can you demystify and just tell us one or two facts about mental health, just so we have a comprehensive understanding of the situation right now? Thank you so much.
Good evening, everyone. And I'm excited to be here today again. After, I think, a while, nothing happened, so we are back here again. All right. Now, you know, mental health is part of health, right? Health is a state of well-being where an individual is able to live. Physical health is there, mental health is there, social health is there, and emotion is there. So mental health is a complement of health. And doctors are seen as, or let me say medicine is seen as a science, but I see medicine as a social science because we are dealing with a society. And the society is what makes that individual. Whatever happens to you results from the society. So mental health on its own is a state of well-being where an individual is able to cope with the normal stresses of life, so that he's able to function productively and is able to contribute to his or her community. In a situation where you have a lot of stress, then they become a problem. We now get ourselves into problem. I want to ask just one question here, because we are talking about mental health and we are all here and thinking the outside world is different. How many of us here will have a family member with mental health challenge and the person comes out boldly and brings him to the hospital and say, this is my brother, this is my sister, this is my mother, she has a mental health challenge, I want you to help her? How many of you? Sincerely, I do not think so.
Just few hands.
Because I am there in the society or in the institution where we see what happens. Is there anybody here without a brain? Is there anybody without a brain here? So if you have a brain, then none of you here is immune to mental health problem.
That's interesting.
That is absolute, because it could result from anything. Simple hit on the wall. You hit your head on the wall and you come down with personality changes. I have seen that recently, where my nephew had an accident on Saturday. A 13-year-old boy who was very calm, and everybody was crying. And what did I tell them? Don't institute medication on this boy. Watch him for the next 1 month to 6 weeks and see. It is likely the trauma is the hit on the brain. You can take a medication and you break down with a mental health challenge. So while we are seated here, I want all of us to understand that mental health is like a mental health challenge. Because when we say mental health, it's like saying physical health. So it doesn't make any sense to me. So mental health problems are problems that can be sorted out just like malaria, like a fracture, like cancer, or hypertension. It's a chronic disease. So because it's a chronic disease, it will be taken care of. Thank you very much.
Thank you so much, Dr. Armiyau, for doing justice to that. I have learned so much, but I've also taken one thing from what she has said. You know, mostly when we hear someone say mental health, we think madman. But then a doctor once told me that in psychiatry, there's nothing like mad. Mad means my adorable darling, and she just proved that. Thank you so much, Dr. Armiyau. So now, Mr. Joseph, you know, looking at what Dr. Armiyau has said about mental health, that it doesn't just mean about, it's actually about living well, knowing how to manage your stress. There's also an aspect of illness, but then there's a difference between mental health and mental illness. Now, looking at the topic, is Northern Nigeria confronting its mental health crisis? This leaves me with something to think about. The question is, now that we know what mental health is there really a crisis? And then you have to also consider that we didn't say mental health crisis in Nigeria. We said mental health crisis in Northern Nigeria. So what does that mean? Is there really a crisis, or we're just overestimating the numbers? Please go on. Thank you, sir.
I think that's a good question, and I will start. I'm happy to be at Kabafest. It's my first time here. Okay. How about now? How about, I was hoping I would get one of those claps to welcome me since they've. Okay. But getting to the question, I think in Nigeria there is a health crisis.
Okay.
What I mean by that is our healthcare system is not the best that it can be. There's a lot. I mean, anybody that has gone to a hospital that works in the system, that has anything to do with the system, understands that the mental health, or rather the health system in Nigeria, is generally stressed. So that means that when people get ill, or for people to stay well, there is, I mean, we could describe it as a crisis. And going off of what Dr. Aisha has just said, if we agree that the head is part of the body, if there is a health crisis, then of course it would include a mental health crisis, because mental health is part of total health. So from that perspective, yes, there is a mental health crisis because there is generally a health crisis, and that health crisis has to do with our healthcare system. However, I do also think that there's a bit of sensationalism to the notion of mental health crisis. And I think that's also because even the concept of mental health has become a bit popular, maybe a bit too popular. And so there's this thing where if everybody's talking about something, it suddenly seems like that thing is a lot more prevalent than it maybe naturally is. So if we're talking about the prevalence of mental illnesses, I haven't seen any data that suggests that there's been a massive spike to crisis level. I'm not saying it's not there. I'm saying I haven't quite seen the data to suggest it. But because we're a lot more aware of it, we're talking about it a lot more often, where it's a lot more present in our day-to-day lives. We're even able to now use mental health as an excuse to not go to work. The generation in question, you know yourself. So you can say, oh, I don't like that because it's affecting my mental health. So everywhere, mental health, mental health. So it may seem like there is a mental health crisis. I guess this is a fancy, long-winded way of me saying, I honestly don't know.
Okay.
Yes.
Thank you so much, Mr. Joseph. So, Mr. Joseph has given me an idea about the next question. Someone just screamed Gen Z wellness. And to be honest, I don't know if there's any statistics that have proven to say that younger people or people in their mid ages tend to suffer mental health issues, or is it the generation comes with more of psychopathology? So now that brings me to the next question to Dr. Aisha. Being a child and adolescent mental health expert, I'm sure you have seen, treated or encountered a lot of young people coming into your center, and then you've treated them. What are the common challenges that these young people face? Do you think also it comes with the generation, or no, these things are actually valid? But why are we getting more of it now? So there are two questions there. What are the common challenges that young people, adolescents, walk into your center to report? And then why do you think we're having more of that now compared to before?
Thank you. Well, it's my first time at Kabafest, so maybe I can get the clap. Thank you so much, and I'm happy to be here. So I'm going to your question regarding children. I'll just do a roundabout and hope to answer some questions that you haven't even asked.
Okay.
Childhood mental health problems. Some of the questions, when I teach medical students, the first thing I ask them, do you even think we should be taking this topic? Do you even think that children come down with mental health problems? And three-quarters of the class are like, no, but they don't have any problems. They're very young, they're innocent, they're dependent on other people. Why should they even have problems? But just like the MD has said, as long as there's a brain, no matter how small it is, as long as there's a brain from day one, it can fall ill. Just like the eyes can fall ill, just like the ears can have problems. So, first of all, let us establish that children can come down with mental health problems. And it is said that 50% of all adulthood psychiatric problems actually start before the age of 14. There would have been signs and symptoms here. Things that parents, teachers, other people in the community missed until it becomes full blown before they bring to the hospital. And that period actually represents a good time when we can reverse many of these things. Because apart from the genetic, apart from the biological, mostly there are social problems, psychological and social problems. Parents are not bonding well with them. They're being bullied in school. They're not doing well in school. Self-esteem problems, and it keeps going on and on like that in a vicious circle. So really, there are things that we can reverse at that time. And then going to the question about the common things that we would see, there are really, it's a spectrum from the simple ones to the very difficult ones. And I'll start with my child as an example. My 3-year-old, when she started pre-nursery in one of the schools here in Kaduna, she began to wet her pants in school, which she wasn't doing at home. And one day the teacher told me that, I saw Nana Aishatu, that I told her that if you wet your pants, I'm going to call police for you. I said, that's not how to do it. I need to come to this school and tell you what childhood mental health is. So that's how I started with a few schools in Kaduna, just to teach them about these things. NUSs, wetting pants, whether it's at night or during the day, not many people will realize that it is emotional stroke mental health distress. So I went to the school, talked to the teachers, and they asked so many questions. And almost every year I do 2 or 3 sessions with them. So we see from very simple things like that: child is not sleeping well, child is child is wetting pants, child is not eating well, to the very severe ones that are out there, the autism, the ADHD, cerebral palsy, seizures will also come to us, the whole gamut of those things. Okay.
Thank you very much, Dr. Aisha. So I hear her saying that not just for adults, even children, they suffer this. And then just like the reaction we just got right now, we see our child being withdrawn, or our child comes tell us, I have depression, but the first thing we say is Gen Z, and then we laugh about it. Just like how we just did right now, not knowing that the child is actually suffering in silence. And we know that the experts can help me here. We know that once mental illnesses are being ignored, they keep on progressing. So we need to pay attention to the signs that she has said. So now coming back to the north and then having mental health on the other end, on Dr. Armiyau, we know that we have this culture in northern Nigeria that when we're facing challenges that look like a mental health challenge or mental health issues, we run to clerics rather than clinics. And that is totally coming from a religious perspective. In fact, we also put some cultural belief and perspective to the situation. So do you think this is one strong factor that is causing the persistence of mental health challenge in Northern Nigeria? If yes, what other factors are there? Because we need to understand the main causal factors before we even talk about interventions. Please shed more light on that. Thank you.
Okay, thank you very much. In a population of 200 plus million people in Nigeria, where you have half of that population in northern Nigeria, with only 5 federal neuropsychiatric hospitals in northern Nigeria
Wow.
and less than 100 psychiatrists in northern Nigeria. Even though we have some departments in the major teaching hospitals like ABU, Ilorin, Maiduguri, AKTH, you can imagine the amount of people you see on a daily basis. Here in my hospital here in Kaduna, we have an average of 3,000 patients monthly, an average of 400 new cases every month. This is just this hospital here alone. And mind you, majority of this population is in the rural area, right? Okay. Now, culture and religion have embodied mental health, but only mental health. If you have malaria, they will take you to the hospital. If you have fracture, well, they can take you to Medauri, he will daure it, and then tomorrow it will malalign, then they will come, will break it, and will fix it, right? At the end of it, they will go there. But for mental health issue, it has been from the olden days, long time ago, where the bad people get mental illness. Once you have a mental health challenge, you have, what did they say to the gods? You have done something to the gods. Yeah. So you have offended the gods. So there's a problem. But if you have pneumonia, you have not offended any god. Meanwhile, mental health is part of health. So what we have done, or what we are doing, is to get the malams and the pastors to come to a round table. That's what we have been doing, right? We call them to come on a round table discussion where we discuss with them to understand that when these people go to them from the beginning, before they get to the hospital, the brain has been scared. Therefore, when you come to us, we can only manage, right? If your behavior is down, you are pooing, you are eating your own feces and stuff like that, is to see if you can be able to at least able to function, able to eat on your own, take your bath, go to the toilet on your own. Those are the things we can do because the brain has been scared. So rather than that, we said, okay, send them to us first. If we can't, then we'll send them to you. And very well said, we have a lot of them now that are working with us. Because if you can't fight them, you bring them close. Since the people are aligned to them, now we are pulling them to us. So they actually now bring patients to us. Pastors bring patients to us. Malams bring patients to us. And therefore, we are also doing advocacy, continuous advocacy. With this mental health thing, you know, it was the COVID-19 that broke the jinx, where everybody understood that social isolation alone can kill you. Because before it was not understood that these human beings that we are sitting here, without us, we cannot survive. Because you can't survive as an individual. So COVID did justice to me. And I really appreciate COVID. Fast forward, because it has brought light mental health, and everybody now is a mental health expert, right? With this expertise that we have, if they could propel advocacy, they are the ones who want to use to do advocacy for us, so that at the end of the day, we will see mental health the way we see malaria and pneumonia and any other physical illness.
Wow, that is a lot to digest. Thank you so much. He has done justice to this because this is something that is troubling us. It's like a cankerworm in our society. The moment we hear mental, the first thing you want to run to is the malam or to the, to the pastor. So, Mr. Joseph, this brings my attention to something. You lead an agency. In case you don't know, he leads an agency on substance abuse treatment and prevention. And we know that sometimes when we see people that have severe mental illnesses, let's say psychosis, we warn our children, you see, if you take drugs, you become like them. Is there a difference between substance abuse and mental illness? And at the same time, looking at state, since you're operating from the state level, looking at state, what are your major obstacles in addressing substance abuse and mental health issues?
Okay, so that's two questions. I think Dr. Aisha has raised another issue that I mentioned earlier, which is the problem with the system. And the problem I mean is We have the Federal Neuropsychiatric Hospital in Kaduna. That hospital is constantly crowded and filled. One of the obstacles we have at Kadbusa is that she can tell you how many times I call her to beg for bed space because we have a client and the hospital is full and we want to see, please, can they join two beds so that somebody stays in the middle, and there's always a space issue. But then when you think about it, this is not the case with malaria. And how do I mean? I mean, we don't only take people to the hospital who have malaria when the case gets to the point where they require hospitalization, severe hospitalization. We know people can die from malaria, but now when we talk about malaria in places like Nigeria, we talk about it very offhandedly because, I mean, who doesn't? But one of the worst things that could happen to you is to fall ill with malaria in a place like the US. And the reason is the health system there, they're very slow to identify it. They don't know what it is. And so they don't manage it properly at the primary level, at the secondary level, until it gets to the tertiary level, which in most cases may even end up killing you. So what we do when we're traveling to places like the US, we carry antimalarials with us so that once we start to feel it, we just take the choir and be done with it. We don't bother with getting, but, and that is a major structural problem because it means that in Kaduna State, we don't have primary level care for mental illnesses. We don't have secondary level care for mental illnesses. We only have tertiary level care. So naturally, that means at the primary healthcare level, you're not going to meet anyone who can recognize a mental illness or even manage it. You can't go to the neuropsychiatric banner and they refer you back to the general hospital or even the PHC for management afterwards. So we're all waiting till it gets severe enough to go to that one site. And that's a major structural problem. That's a major structural problem. And if we leave it this way, we can never address the issue. So one of the things our agency does is we're grateful that we have federal intervention in Kaduna, but it is our responsibility to develop the primary level care and the secondary level care. The argument is that just like Dr. Aisha number 2 said, these things don't just randomly show up. Okay? They are there and they are progressive. If you can teach people how to identify early enough and manage at the primary level, it won't solve the problem. It means that you have less moving on to the secondary level. It means that you have less moving up to the tertiary level. And this whole speech that I've just given you applies also to substance use disorders. Because, yes, it is a mental illness. Why is it a mental illness? It's the brain we're talking about now. So it falls under that broad category. In fact, the WHO classification is mental, neurological, substance, and Kaya failed the exam. MNS, yes, mental, neurological, and substance use disorder. You see, I know these things. And so, yes, that's the broad classification of these types of illness. So everything that I've said about mental illness also applies to substance use disorders. It means that it is not true that it is when the person is an addict that they started having problems with drugs. It's only true that that's when you noticed. And chances are you also noticed at that point because you have your biases about someone having a substance use disorder. So you saw your kid, you could tell something was wrong, but you know that not in your house in Jesus' name, it can never be. So you felt like, if you pray about it, knowing fully well that, it can never be you, this cannot happen to you, it will stop. And then you kept praying and it kept getting worse. And until you got to your house and the child has sold the house, then you're like, okay, well, I guess it's time to do something about it. So we have just as much biases about substance use disorders. And in northern Nigeria, just like in every other part of Nigeria, we also don't want to acknowledge that one of the major, is it predictors or vulnerability factors for mental illnesses, including substance use, is poverty. So when we look at some of the social indices that indicate that you should be having these kinds of problems, I'm not suggesting the problem for you that don't have it. I'm saying that if you look, you would see that they're very present where we are. So for people to have these substance use disorders, I would say it's very normal. I would say what's not normal is not being able to detect and respond to it early enough till the point where it becomes a major medical challenge requiring tertiary level intervention, which is expensive, which is resource intensive because we need psychiatrists and we only have 200 in a country of 200 million people. And it is essentially very, very devastating in its consequence. But if we had started way earlier, we would have dealt with it. One last thing quickly before I move on. When Dr. Aisha number 2, please bear with me. When Dr. Aisha number 2, and she has to be number 2 because this is my boss, so mentioned that her child was wetting herself in school, we thought, oh, okay. But I guarantee you, if a loud explosion-like noise goes off, I would have teamed up with Sheon to try it. And we hear a loud noise that sounds like an explosion right now. Boom! When I now say it's just a joke, it's just a joke. Half this room, if you look at yourself, you have peed your pants.
Yeah.
So again, it's a normal distress reaction. And then if you learn how to manage it, then you may not do it as often. So why wouldn't we see that in kids? So this, I think, it's this change in mindset that we're working on. And it's one of the most difficult things to achieve, to get people to think differently about something that they're used to thinking about in a particular way.
Well, thank you so much, Mr. Joseph. You just normalized, certain things that we saw as abnormal and all that. And you also spoke about the challenges of having very limited facilities. And we have a number of people that need help. And we have a number of facilities like this that actually can occupy these persons. So that actually brings me to the next question, Dr. Aisha. We agree. Okay, we agree. Dr. Aisha too, thank you. So we agree that the government has a role to play from what Mr. Joseph is saying, and then there are certain things that have to be in place that probably we cannot have it right in the next 5 minutes. Therefore, we need the role of individuals. And then we know that when we look at family, family is the foundation of a society. And I know that in your center, you have to psychoeducate families. When people come in and they're seeking support, you have to psychoeducate the family on how to provide care and whatnot. So to me, that is the role of individual, in looking out for the next individual. Is there something like a first aid? I know it's not a treatment, but what are some of the things I can do to help the next person around me? Because we have a crisis. We can't wait for all the time. So what can I do to just douse the tension and just ensure that the person is less distressed before we can escalate to a professional, before you can call Dr. Armiyau or Mr. Joseph? What can I do? Some first aid, just like a skill we can learn right now. Thank you.
Okay. Thank you. Talking about children again, they say it takes a village to raise a child. And we know that one of the key features of children is that they're dependent. They don't even have the language to express themselves, to say, oh, I feel my appetite is poor. I feel pain here. I feel a headache. I'm hearing voices. They don't have the language to express that. And even if they did, if there was no one to take them to where they're going to get help, it's as good as zero. If we see a child running around here, the next thing we're going to be asking ourselves, where's the mother? So children cannot take themselves to the hospital. I just wanted to establish, that's all those vulnerability factors that they have. So in catering for them, two things, uh, family and community. But I'll take the community first because I want to mention something special when we get to family. So community, and that's why I said it takes a village to raise a child. Everybody and anybody is our ally when we're taking care of child mental health. From the security man, if he's going to help us, we're going to talk to him. To the nanny in the school, to the neighbor, to the friend, whoever is going to help us, we're going to talk to them. So what we have done, my team and I in our place, We go out to talk to teachers. Teachers are our greatest allies. If we can just improve the awareness, by the time you see this, this, and this, it be like say problem there somewhere. Please move on to the next step, which is the primary healthcare or the secondary healthcare, or please just call me. In fact, please just call Mr. Ike. He knows where to find us. Or please just call Naja'atu. In fact, if you call Auntie Lola, she knows where to find us. You know, so those kinds of things. And actually, they're very cheap. Around the time of COVID, we got a small grant. It was very small. It was 100,000 naira, just 100,000 naira. But with that, we were able to talk to 50 teachers in Kaduna for 3 days.
Wow.
100,000 naira. We spoke to them online. We gave them data to join us Zoom. We talked all the childhood mental health disorders that we know that they will encounter in the class, in the classroom and in their communities. Okay? And then when we come to family, we say that the child is the window into the family. Most times when children have problems, when they eventually land in our consulting rooms, we don't even talk to them just yet. We call the mother, we call the father, whoever is in their environment, and talk to them. What is happening at home? What is happening at home? The child is likely reacting to all of those things that are happening at home. I had one just before I went on leave for Ramadan, and I'm expecting them back next week. The child wouldn't talk. They brought her from Katsina. She wouldn't talk, she wouldn't walk. So that's a conversion, as we would say. 5 years. She wouldn't walk, she wouldn't talk. And I gave them the key to my office. I said, okay, go and wait. I'm still doing ward round. When I finish, I'll come. And as I got into the room, I just said, oh, hello, baby. Come and escort me. I want to pick something in my HOD's office. And she followed me.
Wow.
She stood up and she walked. And she spoke to me. We gisted to and fro by the time before we came back. Yes. So I didn't even talk to the child. I know that she's converting. We'll say conversion disorder. She's converting emotional pain to physical pain. And at the end of 2 hours, the father said, well, we're always fighting, me and the mother, and we're always fighting in front of the children. She's hearing, she's doing this. I said, okay. It's very simple. We're not doing any medication. So you can see how simple this thing is. We're not doing any medication. Parents, please come after my leave. We're going to talk about communication skills. When you're angry, what do you do? How do you tackle it? How do you solve problems? How do you resolve conflicts? How do you say, oh, I'm angry at you, I'm upset? Shikena. And our child is going to go back to school and do everything. But then we also have to look at a special population of children that do not have families or have dysfunctional families, do not live with their families, street children, children in war-torn areas, children who have been, who have adverse experiences here and there. So the big question is, who's catering for them? Also considering that they have a higher likelihood of developing mental health problems more than our normal children who are with their parents in the house. So that's just the poser for all of us. Okay.
I think one quick thing that I would want to do for a mental health check for the audience is, well, it's not really a mental health check as much as it is an honesty check. How many of us, if we had met that 5-year-old child that was not speaking or walking, would have thought this is a mental illness versus she's possessed?
Sincere question. Just raise your. Okay.
How many, if we're being honest with ourselves, your neighbor came to call you to say, come and see my child. And you know this child, they talk, they walk, everything's okay. And all of a sudden, she's not talking, she's not walking. How many of you would have honestly thought this is a mental illness? I said honesty check. Oh.
Honestly, we have just few hands. Though.
I'll take it to the hospital.
Exactly.
Don't worry, I'll get the patient for you. I'll bring the patient here and then I'll ask you how many of you think this one is this.
Thank you so much for the honesty. It means that we still have a lot to do in terms of mental health awareness. That was why I asked, what is mental health? What are the signs that we need to know? How do we know if it's spiritual or then, if it's mental? But Dr. Armiyau helped us. She said, you know what, tell them, come to my center. If it doesn't work, then we do the other one, which is so that means we have to know how to be diplomatic as well. Thank you so much. This brings me to another interesting idea that blows my mind. We're seated here on a panel, we're talking about mental health, social media, mental health. Mr. Joseph is doing a lot of community-based programs here and there. Dr. Armiyau, you happen to see it from a federal level and from a state level, considering where you're placed. Federal government, do you think they understand? In the sense that, do you think there's denial? Do they see it as there are mental illnesses and we need to do something? Are they looking at policies? What do you think? What concrete steps do you think they can take to address this crisis in the North? Do they understand?
Okay, I think now they are understanding now. Before they are not understanding, but now they are understanding. It's all COVID.
That's a relief.
Because a lot of them had a problem. Okay. So now they are understanding that there's a problem. If you remember, we just got our Mental Health Act passed into law, 2021, right? That law, the last one that was passed was 1956. Lunacy Act was what we were using. Lunacy Act of 1956.
1956.
I'm a forensic psychiatrist, so I deal with laws. So that was what we were using. Now we have a Mental Health Act of 2021. Before the Mental Health Act was passed, there were a lot of issues. Just boiling down to interests, personal interest, self-interest. Everybody will be doing his own. Once they are seeing something, they are thinking there is money, they will start running. Mental health, everybody mental health. Come to Barnawa now, you will not come. So that is a major problem, because you will not come to Barnawa, but you are jumping up and down in town saying you are a mental health advocate. For where? Come and join me so that we can be partners. But no. So now the federal government has passed the Mental Health Act number 1. The mental health policy again has been reviewed. And there is a guideline now that is being worked on for suicide prevention to decriminalize it. So that rather than dying, we take you to the hospital and then you get well, right? And also there is a geriatric board now that are handling geriatric patients when they get old. All of us are going to get old. Because if you don't get old, you are on your own. It is a privilege. So getting old for me, we don't call them old. They are older adults, right? And anybody and everybody will want to get to that age healthy. In case of anything, retirement has come and so many other things. That board is now there. Then we have the mental health desk officer in the Federal Ministry of Health who coordinates what we do. And recently, in the National Assembly, there is a new committee for specialist hospitals, and psychiatry is one of that. And we have introduced a lot of school mental health. Before, people thought if you introduce mental health to schools, you will make them move into that. But it's not like that. Because we are evidence-based, we do studies, we do research, we are academicians. So now we have introduced school mental health. She has said it. So now children are taught about mental health right from school. And positive psychology is what we advocate, right? Okay. That is emotions. For them to know the different kinds of emotions. Rather than sadness, hatred, and other things, is love, laughter, cheers, and good emotions.
That's amazing.
And then getting them to have things to do. Because boredom, again, can be a problem. So we engage them. When you engage them, they have things to do. And you build self-esteem, self-contentment. Let them be content. If you remember, there is this thing about poverty and mental health. Me, I'm not agreeing. Because rather than vulnerabilities, we build on strength. Okay. And that's why I don't talk about vulnerability. I talk on strength. If you know a community is impoverished, move there, assist them, get 1, 2, 3, 4 of them, get them something to do. They would go and do it, and they will come and help the community. That is exactly what I'm doing in Barnawa.
Empowerment, wow.
I have about 100 people from Barnawa community working in Barnawa. I had a drainage that has been blocked for several years. I called the youth leader. Youth leader, come, get your boys, come and open my drainage. Give me your bill, and I'll pay you. And they did it, and I paid them.
Wow.
Let them have a feel to be stakeholders. It's not about poverty. If somebody is poor, I am sure he doesn't expect his own children to be poor. So, therefore, since we know about this, I don't like talking. I love action. Let's act to get those things done. So for me, that is what we are doing now as mental health professionals. Since we know, we are pushing towards that lane. And the federal government is doing fantastic. Even the Almajiri school now, there is something going on about getting schools for them. And in my place now, I have an occupational therapy place where I have different trades going on. And I want to collaborate with the Federal Ministry of Social, with the Ministry of Social Welfare here in Kaduna and the Almajiri schools. Let them send them to my hospital, to the OT. Let me teach them how to do computer, how to do sewing, how to do tie and dye, how to draw, how to do drama, because I have a drama team in my hospital, so that they have something to do. So for me, the federal government has woken up now.
Wow.
And we are on them.
Okay.
We are on them now because we are getting quite much now. The psychiatrists, especially in northern Nigeria now, we are quite a lot now. So we are pushing them at the state and at the federal level. So this is
We're happy to have someone like Dr. Armiyau in the system. It gives hope. It gives a lot of hope to mental health. And I guess this is the exact energy that we need. If we have, imagine we have like hundreds, is it even too much? 50 of Dr. Armiyau, I'm telling you, would have moved. Since, do you all agree with me? Please, another round of applause for Dr. Armiyau. So, learning from what she has said, we're running almost out of time. Mr. Joseph, quickly, talking about strength. Let's not talk about the problems because we've addressed a lot of problems. Talking about, the strength. We know that when we talk about substance use, I learned last week that, I learned some years back that you don't call them addicts, you call them persons with addiction because that is stigmatizing. So what do you do in terms of, because you deal with state, so I guess you have a lot of programs, community. So looking at state, what programs do you have that have been proven to be successful in terms of advocating for mental health or giving support to, people? So people should know what you're doing and people should know that there's actually help and there's something that the state is also doing. Case study from northern Nigeria, please quickly, few minutes.
I don't think it's fair that you asked us to list what we're doing and give us not enough time because it could take us days. No, I'm just bragging. So one of the things that Kadbusa is doing is forming partnerships. She's one of our partners, and as you've heard, she's very rich. Her hospital is very rich. So when you bring people to Kadbusa and we say, don't worry, we'll take them. To be honest, the reason I'm saying that with a smile, if you're not looking, I'm sending someone a message. Please, I need help. I beg. I take God beg you. It's probably her, and then she would help out. So these partnerships also help us. But when it comes to evidence-based programs that we have, we're integrating mental health and substance use services at the primary care level. So we have something called drop-in centers for mental health and substance use services in Kaduna. Kaduna is the first state to actually do that as a state government. We currently have 12 of them, and Dr. Aishatu has brought some of her kids there for an excursion trip. But the goal is to partner with all 23 local governments in Kaduna State to ensure that we have a minimum of 100 of these centers, 5 per local government area before the end of next year. So that should provide access points at the primary care level.
Are you listening, please? He's saying something very important.
Mental health and substance use issues. At the secondary level, before we came in, we just had can I announce it? Okay. So we just had an agreement that we would work with the neuropsychiatric hospital to ensure that all 29 general hospitals in Kaduna have capacity for identifying and managing at the secondary level mental health issues. That's a program that we're going to be running with the Federal Neuropsychiatric Hospital and also stepping down to the primary level to ensure referral centers. And then at the tertiary level, the state government is building 4 rehabilitation centers. that are at various levels of completion. There's one in Ikara, one in Igabi, one in Chikun, and one in Kachia. So I
Okay.
think with these structures on the treatment side, and then in schools, we have a program that we just rolled out a few days ago called the Unplugged program.
Okay.
We're doing that in 15 public schools, but the goal is that by the end of next year, we should have that in 255 secondary schools, meaning that at least one public secondary school in every ward will have the Unplugged program. And to put it in context, the first batch of 5 schools that just completed their training comes to about 2,500 students. So you can do the math. I can't do the calculation to scale it up of how many people we're reaching with prevention programs in schools.
That's really a lot. That's like comprehensive. So please, nobody should come and say, maybe in the next 3 years or 5 years, maybe we would not say mental health crisis in North. Maybe we would say somewhere else, but definitely not in North with all these comprehensive, programs and all that. Thank you so much, Mr. Joseph. That was a lot of information. So quickly, Dr. Aisha, in 1 minute, now that we know that we have help, we have treatment centers, we have federal neuropsychiatric hospitals, we have, support at different levels. What can you assure me now as a professional that if I bring my sister, my brother, my family member, a loved one, is there any ethic in your profession that says that, oh, no problem, my client is safe, information is quite private? Because many people will say, no, if you go there, everyone knows your business. So can you just tell us if there's any ethical consideration or just a certain safety? Because I'm sure a lot of people have this question in their minds.
I'm surprised they are asking because there are only 2 people that will go to the grave with your secrets, your psychiatrist and your lawyer.
Wow. Okay. Thank you so much. That was so brief. So there are no cases where the professional bridges that, or is there any clause, or is there any, what happens? Can I sue you?
No, I think that the profession even holds the psychiatrist and all members of the mental health team to a higher standard. I tell people that if you're coming to, they'll meet you on the corridor and say, doctor, please just see me now. Please just see me, new patient. I say, no, we do 3 hours minimum. New
Wow.
patient is 3 hours because we're going to be asking everything. In fact, I have to beg them before I start. I say, look, we're going to ask so many things, including the day your mother gave birth to you. We're going to ask, how long did she stay in labor? Where did she deliver you? What medications did they give her during labor? That's how deep and personal we go.
To have the whole comprehensive picture.
To have the whole of the picture.
So she's saying that everyone is safe. You can go meet
Everyone
Dr.
is
Aisha
safe.
or Dr. Armiyau. You're safe. Okay, you don't have to get worried. So
just one last thing that I'd like to say.
30
Someone
seconds.
says that mental health is too serious a business to be left to the psychiatrists alone. As many as we are, we still have only one WhatsApp group in Nigeria. This hall can contain all the psychiatrists in Nigeria. We'll do our meeting here and we'll stand. We know each other. We know each other. There is nobody that can come and say, I am a psychiatrist. Well, it's not true. So it's everybody's business. It's you and I. Every time we have these opportunities, we'll continue to talk. Please and please, you are our allies. I love you all.
Thank you so much. Thank you so much. Thank you so much. I want to believe that now everyone feels safe because it's like a safe space when we're talking about mental health. No one is anxious anymore. So we'll just take the last 5 minutes for questions. Questions that, wow. Okay, this is interesting. Okay, I'll start with the guy facing me directly. His hands are really high up. No, don't worry. And I'll also be gender sensitive, don't worry. Yes, please, a quick one. You can direct your question to any of them. Feel free.
Yes, thank you. Good evening, ladies and gentlemen. I have 2 questions. My name is Ali Udaladi from Gombe State, and as someone who hails from northeastern Nigeria, I've been exploring issues that relate to mental health issues, particularly of victims of Boko Haram insurgency, because Boko Haram insurgency has been the largest event that changed the socio-political trajectory of this country, including the mental aspect. but you'll find out that the mental aspect is being overlooked. Because I was even shocked to know that most of the advances we have had in policy regarding mental health were formulated during the COVID-19. Whereas we had Boko Haram that had a more devastating effect on mental health. Not only the victims, but even the neighbors of the victims, like myself who lived in Gombe, and even in Kaduna or Kano, you are always living in daily fear of a Boko Haram attack, of a bomb blast or so. But there wasn't that concern. So I think my question is, because even up to date, I know there are still people who have been traumatized from the Boko Haram insurgency experience. So what is the federal government doing to see that these people are truly rehabilitated? That's the first question. And the second question is a gender dimension
That's
to
more than
mental.
two questions. One question at a time, please. After him, we have many hands.
Yes.
Please, sorry, we just have to take one.
Yes, let me. It's just to Dr. Joseph, please.
We've taken one person. Yes, please, the lady with the blue.
Okay,
Quickly,
thank
please.
you.
Thank you so much. Thank you.
Okay, good evening. My question is to Mrs. Aishatu. So
Dr.
she
Aisha.
mentioned something about seizures. So I wanted to know, is seizures linked with mental health? Is it seizures that causes mental health issues, or mental
Seizures.
health issues causes seizures? So
So
that's
do
my
they lead?
question.
Okay, do they call? Okay,
How are they
seizures.
linked?
How is it related to mental health and physical health?
Yes.
Thank you. We'll take okay the female. Am I gender sensitive? We'll take one, just one more from a male. Yes, please, the female. Yes, ma'am.
Please, my name is Rabi Lawal, and my question is, what's your take on parents who tend to lock their kids up, all in the name of them building their moral character, rather than them being going wayward, when even on their noses, they could actually go wayward? I feel every child is born free and he has the right to mingle. And locking him up will actually affect his mental health. But parents feel they always want the best for us, and everything they do is in good health, it is in good faith, sorry.
Okay.
But what they want for us is not always the best for us.
That's correct. Thank you so much. Did you get the question? Okay. One. Okay. Let's take it from Auntie, please.
Good afternoon, everyone. I'm Wing Commander Bashari. Um, it's like I'm envious. Yes, I'm very, very, very envious because you people are just talking of Kaduna State. Kaduna State is just one state out of the northern parts. Kano State is, I think, is one of the topmost states that have this mental drug, whatever, whatever. And it's like, let me just carry you people back to Kano to come and help us, to see how you can help us do that. And another very, very important thing that I think we tend to forget is that nowadays, you see this useless thing they call a phone.
Mm-hmm.
That thing, I call it, is the dujal of our time. Yes, because it's the one that is ignoring the work of the parents. You will see parents on the table, everyone is just chatting, children chatting. You don't even care about your child. You don't know what your child is going through. You are all after, my friend is chatting me up. No, my boyfriend, my girlfriend, no, my friend. I'm looking for money here, right, left, and center. So there is a lot of things that we as parents, we as elders, we really need to sit down and work on
Look at,
our
yeah.
own psyche.
Okay.
We need to work on ourselves before we now reach out. So therefore, I think I will request, after this long discussion, I will request your addresses, and when I get to Kano, we'll try to get in touch with you people to see how you can help us. Thank you very much.
Thank you so much. We hope that the doctors and Mr. Joseph will be able to squeeze some time, to go help Kano out. So I think we're okay with the questions.
Let me take that first one.
From who? Which lady? Please. Oh, okay. Okay, Miss Zara, please. Yes. Sorry, I've taken 3 ladies. I'm so sorry. Maybe in Kano we'll take more of the men.
Keep quiet. See his head like gender says to. Good afternoon, panel. Love you guys. My question is, you've talked about interventions and partnerships that you have. One of the things that's always bothered me, and you and I, we've talked about it when I was at the National Assembly, is the role that Nollywood and Kannywood play on how the Nigerian society perceives mental illness. So I want to know, do you have any partnerships or collaborations with people in these industries to remove the stigma around mental illness and to also make mental illness something that should be part of life? Mental health, sorry. Thank you.
So thank you all. Let's start taking the first. That's all for the questions.
That one. Okay. Boko Haram. I'm just going to answer brief.
Yes,
Afterwards, if you want more answer, we can talk outside before I go. Now, pertaining Boko Haram, sir, our policies have been there since 1956. It was then our policy, mental health policy, has been there. It has been reviewed. It is reviewed, right? Then our Mental Health Act, we had a new one. It's not that it was not there. And if it's Maiduguri, Federal Neuropsychiatric Hospital Maiduguri had a lot of stake during Boko Haram in Borno. And they had a lot of grant from NGOs. And they were moving even into the city, into the villages where they were combating PTSD. So currently, those that still have PTSD, it is their responsibility now to get the service. All right? And we can tell you where the services are, but they are there. We even have some of them here because some of them are here in Kaduna and we see them in our hospitals. So you can let them know that there are services, so they should take personal responsibility and be intentional in getting their care. Then I will just talk about media. Naturally myself, coming to Kabafest, well, I've met a lot of people, but personally, me and media, we are like this. Because I fight them. What you don't know, please ask. What you don't know, ask. We are there. We will guide you. We will help you. We will navigate the terrain because you are the face of the people. People watch TV, especially this Nollywood. People watch it. So please get to us. In fact, some of us will even go and do the drama. No problem. As long as mental health will be portrayed as good. Not these people with all these dirty things on their body, or they went to the hospital, there was no cure, then they will go to the Babalawo and then you get, no, please. So we are now partners. So let us partner and we would help you to navigate. We have engaged quite a number of media people of recent, both the newspaper and the television, on how to communicate and present mental health. So please, you can help us to navigate that terrain. Thank you.
Oh, sorry, let me quickly take mine. I think the only question I will respond to is the jealousness from Kano State. And the jealousy, not jealousness. See, wala.
Envy.
So, Kano State jealousy. I think we have failed as a panel. And I say this because the goal of this panel was to have the jealousy of all 19 northern states.
That's correct.
And if it's an FCT, so if it's only Kano that is begging us to come, we have to do this panel again same time tomorrow.
Yeah.
And see if we can meet but please, yes, by all means, we're willing to help. Thank you.
And please, again, Kano. I studied in Kano. I worked in Katsina. I worked in Kaduna. I worked in Bauchi. I worked in Gombe. I worked in Plateau. I worked in Benue. So I have worked in all the zones of the north. And excellent question that you asked. They are all different. They are all different.
Unique, yes.
You see the different people in the North Central. You see difference in Northwest, and you see difference in Northeast. I work in all those zones.
Quite unique, yes.
So I know how they operate. And this thing that we are talking, can be replicated in all these places. And I can move around there as long as it's mental health.
Thank you so much.
Thank you.
Thank you. Thank you. The last question we're going to answer.
So my own questions are very sharp. Seizures. Seizures, while they may not be classical mental health problems, but they are usually follow-come with mental health problems. And actually the training is neuropsychiatry. So usually there's a bit of overlap. What they can do, we can do. What we can do, they can do a bit of. Seizures can lead to emotional problems, and sometimes mental health problems can come with seizures as part of the complex. Parents locking up their children to sort of restrict them from whatever is out there might take, and I believe everyone on this panel's take will be, no, it is not healthy. For how long can you protect them from what is outside? Rather, we focus on building in them the skills to survive and navigate the world. Resilience, assertiveness, the ability to say no. The ability to say no. The ability to say no. That is 1, 2, 3. Because those things will come. Their friends will say, we have exams tomorrow. You see this thing? If you just take one, you will not sleep. You'll be able to do TDB, TNT, and that is the gateway. So their ability to say no, that is what we're going to focus on. You can't lock them forever.
Thank you so much. Thank you so much. Another bigger round of applause, please, for the professionals. Thank you so much.